Good afternoon, everyone. Welcome to a webinar on managing neurological conditions during COVID-19 with a specific focus on how to ensure that your rehabilitation is in progress and how to manage the mental health aspects of it. Quick introduction about Patients Engage. We are an online platform which has been operational for over 5 years and focused on holistic and evidence-based management of chronic conditions. We specifically look at disease management from the perspective of patients and family caregivers. We cover over 50 different chronic conditions, and we have a lot of communities. Our basic belief is that lived experiences and understanding them help you being informed and empowered to lead better quality of, lead a better life and also make better decisions. We've been doing webinars now for a couple of years, but during the during the COVID pandemic, we thought it is important for us to go into specifics about how to manage this, given that a lot of your routines and a lot of your care processes have got affected. Also for you, the idea of course is also to look at this, not really opportunity, but look at this as a way to not get cowed down and not just be afraid, but to look at making little changes so that you can continue to, kind of improve your quality of life. So we've been, as some of you may already be aware, we've been covering various chronic conditions over the last few days. And today we are here to talk about neurological conditions, specifically conditions like Parkinson's as well as stroke and so on. We have with us today Nicole D'Souza and Tejali Kunte. Nicole is a physiotherapist who is the head of therapy at PDMDS, and Tejali Kunte is a clinical psychologist, again with the focus on Parkinson's. And for all of you who do not know, PDMDS, or Parkinson's Disease and Movement Disorder Society, has been around since 2001, and their motto is working to improve the lives of people with Parkinson's in India. If you are logged into Zoom, you can post the questions on the Q&A or the chat, and if you are on Facebook, you can put on the live feed. I am trying to see if we can get the questions from the YouTube feed as well. Hopefully we can. Okay, and yeah, as most of you who are long-term users of Zoom know, you can rename yourself, and also here are the social channels that we follow. So I think I'll quickly get started with the questions. Nicole, people are at home and their routines are affected quite a lot because of the lockdown. They can't get their physiotherapist home. Their exercise routines have been affected. So what can they do to, keep fit?
Yeah, thank you. I know these are really tough times, and an important message is that do not stop your rehabilitation. जो आपका therapy है, आपको वो रोकना नहीं है. Even if a therapist is not coming home, doesn't mean you need to stop. Because whatever gains you have made, जो improvement हुआ था, वो मतलब कम नहीं होना चाहिए. It shouldn't go back to what it was originally. We want you to maintain whatever improvements you have got. And there are actually, we're very lucky at the time that we're in, and all you need to work out and do your therapy at home is a bit of creativity, assistance from your therapist. And if you have an internet connection, then you have an unlimited resource to finding exercise programs online. Unfortunately, न्यूरोलॉजिकल कंडीशंस में इतने सारे अलग अलग कंडीशंस होते हैं, जैसे लकवा होते हैं, पार्किंसंस होते हैं, मल्टीपल स्क्लेरोसिस होते हैं, स्पाइनल कॉर्ड इंजरी, अलग अलग स्टेज पे भी होते हैं, सिम्टम्स अलग होते हैं, डिसेबिलिटीज भी अलग होती है। तो ऐसा वन प्लान फिट्स ऑल ऐसा नहीं है. We can't give one therapy plan for everybody. And that's why it is most important that you ask your therapist for an exercise plan which you can follow. And अगर कोई online resources है या कुछ exercise sheets है या handouts है, वो भी आप follow कर सकते हैं. दूसरा important tip जो है कि आपको एक schedule time fix करनी है दिन में. ऐसा नहीं होना चाहिए कि हाँ जब भी मैं free होगी या when someone else is free at home then I'll start exercising. Then that usually doesn't happen. So it is important to keep a fixed time in the day for your exercise to be done. Sometimes ऐसा होता है कि आप therapy time के आप weights use करते हैं या TheraBands use करते हैं. Now you can be more creative. You can use water bottles filled with water. You know, if you have to do squat exercises, you can use school bags filled with books, food cans or tins also. Or it's very easy also to make your own strap weights at home. You just need to fill 2 pieces of cloth with some grains and put a Velcro strap and you have your own weights at home. So there are a lot of things that you can do at home. The other thing is that if you do require help during your therapy, appoint someone in your family to assist you in the therapy. It's also fun when you're exercising with somebody else. Set a goal. I think it is so important. We don't know how long the lockdown is going to be for. It's important to set goals for yourself so that you're motivated to exercise every week. And they can be small goals like walking 500 steps or doing 10 squats or, you know, doing a certain exercise 20 times. But these are small goals that you should incorporate so that you'll feel that sense of achievement or motivation. All exercise plans should include strength and stability, मतलब जो आप weights के साथ करते हैं और balance exercises. दूसरा जो है वो जो stretching है, जो muscles को elongate करते हैं, आपके body को जो stiffness जो है वो कम हो जाते हैं उससे. और तीसरा जो है वो cardio exercise बोलते हैं, जो heart और lungs को activate करते हैं, जैसे walking, cycling, marching, jogging. वो सब आपको include करना है.
Okay, thank you, Nicole. So you know, Nicole ने बताया कि आपको कैसे fit रहना चाहिए. How can you stay fit? I guess also I'll come to you, Tejali. You know, with this lockdown, बहुत चिंता हो रही है लोगों को. There's a lot of anxiety, stress है, depression भी है. तो आप थोड़ा इसके बारे में बता सकेंगी?
Yeah, sure. So as we all know that we are in a lockdown and it need not only affect our physical health, but it can also have a big impact on our emotional and psychological well-being. Because there are some, जैसे कि जब भी हम लॉकडाउन में हैं, हम बहुत लोगों को मिल नहीं पा रहे हैं, हमारा बाहर जाके हमारे फ्रेंड्स को मिल नहीं पा रहे हैं, या एक जो खुली हवा में जाना है हमें पसंद है वो हम नहीं कर पा रहे हैं. और इसकी वजह से वी कैन हैव डिफरेंट इमोशनल रिएक्शंस ड्यूरिंग दिस टाइम. सो पहली बात तो ये है कि आपको जो न्यूरोलॉजिकल कंडीशन है उसके साथ आप एक जो आपका खुद का एक फाइट है, एंड along with that now you are in a lockdown, so there are a lot of limitations around you that you may not be able to meet your therapist, you may not be able to meet your friends, or you may not be able to go out, and that can bring a lot of anxiety in you that what is going to happen next, how I'm going to survive in this period. Can I continue talking?
Yeah, sorry.
Yeah,
go ahead.
Yeah, so first of all, it is very important for us to understand that this can also have an impact on our psychological well-being, and what are the different reactions or possible feelings that we can have during this time. So जैसे अपर्णा ने बताया कि एंजाइटी एक बहुत डर डर सा लग सकता है ये पीरियड में कि ये कब खत्म होने वाला है, क्या मुझे इससे असर होने वाला है, क्या me or my family members are going to get affected by this condition, which is in addition to your already pre-existing condition. And especially the population that we are looking at, maybe Parkinson's, जो ज्यादातर 60 के ऊपर के एज में दिखाई देता है, तो बहुत सारे चिंता हो सकती है, बहुत सारा स्ट्रेस बढ़ सकता है कि ये कब खत्म होने वाला है, या हम इससे जब भी छूटेंगे तो हम ये ऐसे ही हालत में रहेंगे या कुछ बदल होने वाला है उसमें, लॉट ऑफ अनसर्टेनिटी, क्योंकि इसके ऊपर पूरी तरह से अभी तक इलाज अवेलेबल नहीं है. या यू कैन ऑल्सो फील इनसिक्योर इन टर्म्स ऑफ not being able to not being able to feel secure in your own surrounding, because when you go out, or if you just want to touch something in your house, there's always a fear that am I being affected by this particular virus, that is COVID-19. So, and also the lot of WhatsApp messages and forwards that we are getting these days, it can have a big impact on our life, because we are constantly thinking about COVID-19, and we have kind of shifted our focus from our family, from our pre-existing condition, to a completely new something new which we were not aware of uh, before this.
Right.
It can also bring a lot of boredom, because अभी ये शायद बहुत सारा बोर लग सकता है कि ये बार बार हम उसी फैमिली मेंबर्स को ही मिल रहे हैं, शायद सब लोग अपने अपने एक्टिविटीज में या वर्क फ्रॉम होम में बिजी है, एंड दैट्स व्हाई द पेशेंट विथ neurological condition can also feel bored to an extent that bored to even exercise, or bored to have a daily routine. लेकिन ये boredom आपकी inactivity को इंक्रीज करेगा और आपकी जो फिजिकल और मेंटल स्ट्रेंथ है उसको कम करेगा, तो इसके लिए हमें बोर्डम से भी छुटकारा पाना इम्पोर्टेंट है. Or you can also feel the loss of control, that we are not being able to control this particular situation at this point, or we are not being able to manage our symptoms at the best when we are home because of certain conditions. स्लीप डिस्टर्बेंसेस भी हो सकते हैं, जैसे कि बहुत सारा ख्याल हमारा इसी के बारे में चल रहा है कि ये कोविड-19 क्या है, इसके ऊपर कब आएगा इलाज, या इंडिया में कितने लोग या बाहर कितने लोग इससे अफेक्ट हो रहे हैं. सो कॉन्स्टेंटली ये जो हमारे तरफ न्यूज आ रहे हैं, we can also get very overwhelmed with this all the news that are going around, and that can have an adverse impact on our sleep. Either in Parkinson's, usually people have different sleep disturbances, like they may not be able to sleep properly, or there might be some sleep disturbances, nightmares. And if you are going through a condition, or if you're constantly thinking about what is going around, it can definitely adverse the sleep disturbances that you may already experiencing, or there
Right.
might be a feeling of loneliness. So these are the possible reactions emotionally that you can experience during this time. So it's very important to also focus on our mental and psychological well-being along with the physical health.
Right. Thank you, Tejali. I guess before we continue on this, एक question आया है. When I get up in the morning, I have pain in all joints, especially in hand finger joints. Nicole, you want to address that question?
Actually वो डिपेंड करते हैं कि आपको कौन सा तकलीफ है, कि वो मतलब सिर्फ आर्थराइटिस है, आपको पार्किंसंस है. यूजुअली एक्चुअली क्या होता है कि इन द मॉर्निंग मतलब 8 घंटा पहले आप सो रहे हैं, कुछ एक्सरसाइज नहीं किया, दवाई नहीं लिया है, तो सुबह ऐसा होता है कि मसल्स थोड़ा टाइट हो जाते हैं. तो इफ यू स्टार्ट ऑफ विथ कुछ रेंज ऑफ मोशन एक्सरसाइजेस, जैसे हाथ को ऐसा 5 बार करना है, रिस्ट को सभी जॉइंट से, नेक गर्दन से पूरा नीचे तक सब जॉइंट्स को थोड़ा मूव करो, तो शायद वो दर्द कम हो जाएगा. But so it depends a lot on what the pre-existing condition is.
Right.
But usually just warming up the joint, जो warm up बोलते हैं, body को warm up करना है, क्योंकि अगर सिर्फ सुबह में होते हैं और शाम और दोपहर को नहीं होता है, मतलब ये सिर्फ warm up चाहिए, सिर्फ warm up से वो शायद ठीक हो जाएगा.
Okay, thanks. Which is the right time to exercise, on period or off period?
So ideally the on period is the right time to exercise, because that's when you can give your full potential, or you can push your body to exercise more as opposed to your off period.
Okay, thank you. One more question. I want exercise for slow movement and balancing.
So I'm assuming the slow movement is a very well-known symptom of Parkinson's, and we do at the Parkinson's Society, we do have a lot of resources to help you with these exercises, and with these exercises to help with your slow movement, which is called bradykinesia. One thing you can do is boxing, which is something that everyone of our patients really like, or fast and big movements. So we have a lot of handouts, and we have a lot of exercises available, which we are going to be sharing with our groups. You can contact us, and we can definitely help you with those exercises and those movements.
So just a quick letting people know that before we end this, we will share a screen with the contact details and where they will be sharing some of this content. Okay, there's a question on diabetes, I think, but I'll let you. We will be addressing diabetes in the next couple of days. So just watch our page for the announcement on when we are doing a diabetes webinar. We are getting an endocrinologist to talk about that. I think there was also a medical question. I'll let you decide, Nicole, if you want to take that. Daily, I take Syndopa Plus, 6 tablets, but from lockdown, doctor has made it 4 only.
So usually if the doctor has reduced it, he's done it for a reason. If you feel that the 4 tablets are not working for you and that you are still not able to go about your daily activities, you need to contact your neurologist again to see what can be done about that.
Right.
I would just like to add a disclaimer that in case of any queries related to your medicines, please contact your neurologist, because they are the best person who would consult for the medicine part of it.
Correct.
Thank
yeah, absolutely. So I think that's definitely something that you need to check. I think we're getting a couple of questions on diabetes. Again, reiterating that we will be doing a session on diabetes in the next couple of days. So please join in then. Thank you. Okay, so Tejali, I guess you talked of the kinds of mental health concerns and issues that this lockdown is causing, but what can people do to manage this, manage their emotions?
Yeah. So, firstly, I think it is very important to know and identify what kind of emotional reactions or feelings that one might be experiencing during this time. So, having the understanding will really help you manage with the symptoms or the condition in a much better way. So, if you feel that you are feeling more anxious, I'm just taking an example of Parkinson's, because if you feel anxious or if you're really stressed, it can also have an impact on your physical symptoms, like you might see the increased tremors or more freezing or more speech difficulty. So you need to understand that this might be causing but the root cause could be the anxiety or the stress which is building up in your mind. So doing some basic things can also help you manage these symptoms when they arise and when you identify them. Something about being mindful, so not thinking too much about what happened yesterday and how I was doing much better yesterday and what is really going to happen to me in the next couple of days or a year or a month later. I think the best thing is to do is one day at a time. Just focus on your health for today and how you can give your best in today's day, and how you can exercise, how you can keep yourself active and engaged throughout the day. So I think having that focus shift from past to present, having the focus on the present, past to future, having the focus on your present will really help you during this time. So now, not counting the days of the lockdown, it may be 21 days or I don't know how many days more, but just staying focused on today will definitely help us manage our symptoms. You can definitely engage in many different activities using art, dance, something creative, because that will keep you engaged. that will lessen the anxiety or the stress that you are going through. That will also improve your eye hand coordination. It will keep your brain and body both active at the same time. You can also involve your family members in these kind of activities. It could be dance, it could be singing, it could be painting, something that you like doing together. So it can also bring in a lot of more cohesiveness in the family as well, and you can enjoy this time to do something more creative. I would suggest to limit your screen time, be it your mobile or your laptop or your TV, apart from the work, because constant screen time is also something that can cause a lot of anxiety and stress, because we are constantly exposed to the news about COVID-19, and constant updates is not something very helpful for us during this time, because we are not been able to change the condition completely, but maybe staying home is something that we can do. Then I think we can focus more on what is in our control, and we can do what is in our control the best, like maintaining hygiene or practicing social distancing. So I think if you can just focus on what we can't do at the moment, but focus more on what we can do still in the lockdown, I think that will bring a lot more positivity and optimism in ourselves and the people around us.
Right.
um
Thank you. Thank you.
yeah.
Um, so let's just stop sharing. We'll take a few more questions. There was a question on, is there any medicine to increase dopamine? Again, I think on medicine, please discuss with a neurologist. And I think we can repeat that one more time. There's a question on, what do you suggest for increase in pain with slower lifting of legs to walk?
Sorry, there's increase.
In pain with slower lifting of legs to walk.
So unfortunately for that, I would actually need to assess you to see whether it's an injury to the muscle, and that's why every time you lift your leg, you're getting the pain, or is it pain due to a joint issue? Unfortunately, just from this, if there is something causing pain, if there's been no injury, if you haven't had a fall, or you haven't done something like you haven't had a slip or done some exerted yourself, then maybe you can try an ice pack and see if the pain does come down. If it doesn't, I would suggest that you do a one-on-one call either with your doctor or your physiotherapist to understand more about why that pain is occurring. Because pain is definitely a sign that there is something injured or something which is not right, and you need to be careful.
Okay. I guess there's a couple of issues about exercising in the morning. How to drive out the lethargy in the morning for doing the exercise. We tend to procrastinate is one. And the second related question, not quite the same, but early morning, the rigidity in walking is more. Should one have Syndopa on empty stomach for exercising better?
Okay. Yeah, so that's quite a few questions.
Yeah.
Yes, Syndopa does work better on an empty stomach. So if you do take it on an empty stomach, you will see the effects working better. But if you do have nausea whilst taking it on an empty stomach, then it's advisable actually to have it with a small carb meal, like maybe a biscuit or so, just to help with the nausea. Exercising in the morning is difficult even for me, and it takes a lot to just jump out of bed and do it. But once you do start the exercise, know that you will feel better, your body will feel looser, you'll feel more energetic, and I can tell you that from personal experience as well, because getting up from the bed in the morning is quite hard, but once you do, you will see a difference. Parkinson's symptoms themselves, they are more in the morning for a lot of people, and the reason being is that your last dose is probably the previous night at 9 o'clock or 10 o'clock, and you have about 8 hours when you're not taking any medication, you're not doing any movement, and so the body obviously is reacting to that and slowing down. The minute that's why most doctors recommend that you take your first dose as soon as you get up in the morning, so that your body, the Syndopa starts working and your body gets looser. And also, if you start with a few exercises right from the bed, a few rotational exercises, that helps to reduce the rigidity in your body.
Okay.
Also, I
Um,
think it can
sure.
make your exercise routine a little more interesting in terms of playing on some music while you're exercising, or involving a family member, using some props in the house like a ball or a bottle, like Nicole suggested. I think doing exercises all alone is little more boring and lethargic as compared to during doing the exercise along with the family and with the music. So you can try that as well.
Right. Okay. It's a good idea. And I think there was, uh, I am not doing any physiotherapy. I have difficulty in walking and freeze from time to time. I practice Brahma Vidya for 1 hour every morning since last 5 years.
Okay, so I think it's great that you are doing something like Brahmavidya and you clearly enjoy it since you've been doing it for so long. But I have to scold you because you're not doing physiotherapy, which is the reason why you do have difficulty walking. And it's quite difficult to start exercising and to get into a program. But once, that's why I said, once you put it in your schedule and say it's something I have to do, like it's like taking a pill or taking medication, then it becomes part of your daily routine. And I'm sure if you exercise, you will see the difference in your body. And like Tejali said, now we're so lucky that we have different ways of exercising. And exercising just doesn't mean doing strengthening exercises. You can do yoga, you can do dance, you can have variety in your program. You can look at online videos and see group exercises that are happening. You can exercise to music. There are many ways to do things and it doesn't have to be boring. So if you do know a therapist who you can contact, they can actually give you different ways in which you can exercise. And it is very important that you choose an exercise program that you like, because it is something that you have to do lifelong. So choose something that you enjoy, and it doesn't have to be something that's enforced on you. Realize that you are going to benefit from it, and do it.
Okay. Question for you, Tejali. Two questions on being concerned about isolation. So one person says, I'm a bit worried about thinking that should I get COVID-19, I would be isolated and I can't live alone. Any specific suggestions? Another one asks, what is isolation for Parkinson's patients?
Uh, okay, so the first question is about thinking about if I get COVID-19 and then how I'm going to manage the condition. But again, I would give you I will come back to the suggestion that I gave you, that focus on what you can do at the moment is practicing hygiene, maintaining hygiene, practicing social distancing, and also maintaining a diary of your symptoms. So if you think that any other symptom is arising, please make a note of it and consult with your doctor immediately. Don't wait for for too long for the symptoms to get worsened. That is one thing. And secondly, don't think too much about getting COVID-19 if you are in a very safe space and if you are with people who are also practicing social distancing and maintaining hygiene. Because if you are not going out, I think the chances of getting this condition is much lesser. But if you are constantly going to think about what if this happens, that is actually going to cause a lot more stress in you at the moment. So I think that is one of the things that you can do to change your thinking from if I get it to what can I do to not get it. So I think practicing the prevention strategies will definitely help you at this particular time.
Right.
uh, the second question about what is.
What is isolation for Parkinson's patients? Tejali, can you keep your mic a little further away from your
Oh, sure,
mouth?
sure.
Yeah, a little bit.
Yeah. What is social distancing for
No,
Parkinson's
not so far
patients?
away.
Okay, sorry. Is it audible now?
What
Yeah,
is
yeah.
isolation?
What is
What
isolation for Parkinson's patients?
I
I'm
think if you
not
are
quite
living in
sure.
a
Yeah.
family where everybody is healthy and not having any symptom of COVID-19 like coughing, sneezing, fever, or all the symptoms that have been given for COVID-19, I think you don't need to worry so much about keeping yourself completely isolated within the family. But definitely you need to practice social distancing, not going out of your house for a couple of more days or months till the further notice given by the government, all the health authorities, to keep yourself safe.
Right, right. Okay, thanks. There are two or three questions around breathing. So one person says my husband does breathing exercise early morning, helps him a lot. Somebody asks whether they can continue breathing exercises. And a third one says many of the NDD result in breathing disorders. Do you suggest any specific exercise to avoid congestion?
So yes, the breathing exercises are very, very important, not just now, more so important now because COVID leads in severe cases to respiratory disorders. So it's very, very important to do your breathing exercises. It helps to oxygenate the blood and the body and helps to function better. There are different types of breathing exercises, and you can choose from pranayama to regular breathing exercises. But it's important that when you breathe, you have to make sure that your lungs are fully aerated. So it's not just short breaths, but they're deep, long breaths. And there are different ways to do it, and any therapist would be able to do it. A cardiorespiratory therapist in particular would be able to help you with the different ways to aerate different parts of your lung. And also when you exercise, you actually breathe along with the exercises, and that helps in expanding your rib cage and expanding the lungs as well. So exercise is also a way, and breathing along with the exercise is also a good way to do both at the same time.
Also, breathing exercises will definitely help you manage your anxiety and stress during this time. So we would definitely want to encourage more breathing exercises and relaxation techniques during this time.
Right, right. Yeah. And I think it's always good to remember that to focus on exhaling out. Long exhaling out is always a good thing especially for relaxation. Somebody says, since I don't walk now, so there is body mein stiffness aa gayi hai, जिससे slow movement hota ho gaya hai. So I guess the struggles of going out for walks is kind of the point here.
तो अगर आप बाहर नहीं चलते या घर में भी नहीं चल रहे, लेकिन अगर आप घर में भी नहीं चल रहे तो बहुत सारे एक्सरसाइजेस हैं जो आप बैठ के कर सकते हैं, जैसे चेयर एक्सरसाइजेस, चेयर एरोबिक एक्सरसाइजेस है, चेयर योगा है, बेड पे भी एक्सरसाइज करते हैं. अगर आप बाहर वॉक के लिए नहीं पा सकते तो आप मार्चिंग भी कर सकते हैं, सिटिंग और मार्चिंग. ओके, तो बहुत सारे ऑप्शंस है. And you just need to talk to your therapist और वो आपको बताएंगे. लेकिन अगर if it is just the walk, cycling भी एक exercise है जो walk के it's comparative to the walking, or marching while sitting also it's the same thing.
Right. Okay. One question is cupping suggested to avoid congestion?
Cupping or coughing?
Cupping.
So cupping therapy. Yeah. Okay, so there's a cupping therapy and there's cupping which you do. So that usually has to be done, and it is used actually when you have mucus in and you want to loosen it and help it to come out. So that's when you usually do it. And usually a therapist would advise you if that is required or not. If you're not using a nebulizer, and then just cupping it may not actually work. Usually you use a nebulizer to help thin out all the secretions, and then you do cupping and clapping to actually take off the secretions and help you cough it out.
Right. So somebody's suggesting whether we do a small breathing or progressive muscle relaxation sequence online right now. Be in the present and spread ideas of what can be done in a creative way.
Tejali is actually at this progressive muscle relaxation.
Can we do this at the end of the session so that everyone can relax?
Yeah, so you can do that. I'm getting acidity full day, says somebody. What to do about that?
So I think I think in this point of time, a lot of us are snacking on things that we normally would not have, and I think it is in this time that it's important that we eat a nutritious diet, we sleep enough, we exercise regularly, we find time to laugh, because all this boosts the immune system, as opposed to just sitting around watching TV, eating junk food. All that's going to cause acidity if you're anyways prone to it. But if it's something that's really bothering you, then I think you need to call your GP and see what he has to say.
Right. Yeah, and acidity is also linked to stress and anxiety. So, it's also important to work on that. I have Parkinson's, no other medical issue, but I'm continuously losing weight and not gaining weight. How can I gain weight? My current weight is 38.
Okay.
So usually sometimes some people with Parkinson's who have swallowing issues, that can affect the amount of food they're taking in. Another thing is dyskinesia, which is constant movement of the body, and that can cause them to expend a lot of energy, and so they tend to lose a lot more weight. Also, people who are depressed, apathy, they also lose interest in food. People who have dental issues, and also as you age, you do their taste buds do change, and food doesn't taste as good. So one reason could be that maybe you're not taking enough food. But if you are
Because
still
of the tremors. The
so
tremors can also
excessive,
add, yeah.
so one option is to take more carbohydrates. So that would help you put on weight. But if you're still losing too much weight, I think it's important that you need to go and do a blood test to see if there's anything else which is causing the weight loss. If none of these reasons are why you are taking in less calories, so the option is to increase your calories, which is with high calorie food like carbohydrates and fats and things like that.
Also, you can make some healthy options. Like if you think that it's difficult for you to eat properly because of the tremors and because the longer times that you are taking to eat food as compared to how you used to do before, and that is one of the reasons why people tend to eat little less than what is their body really requires. But something like idli or some finger foods which are easy to eat, you can also opt for those things. Or you can also include the dopamine enhancing foods in your diet, like banana or dark chocolate or some dry fruits. So you can munch on these healthy snacks as compared to just eating fried and very sweet food. But you can definitely consult a dietitian or a nutritionist if this is a persistent problem.
Okay, thanks. One question that came is, can you please suggest some exercises that my mother can do? She's getting sudden pulls in her right leg. Anything for relief from that? Not 100% sure.
So sudden pulls could be like a catch, or it could be a jerk. I'm not really sure which one it is. If it's a jerk, then if it's not been seen by a neurologist, it's something that needs to be seen. Jerks are just sudden movements. But if it's a catch, which is coming where the muscle becomes really tight, or it's going into like a spasm, then there are certain stretching exercises that can be done, which will help to reduce the pain due to the stretch.
Okay. Two questions on sleep. One says, I feel sleepy full day. Another one says, मुझे आजकल रात को नींद नहीं आती.
Okay, so these are common complaints of sleep in Parkinson specifically. One could be insomnia, where you are not being able to sleep immediately and you are taking very long after you go to bed, like more than an hour to fall asleep. And one could be excessive daytime sleepiness or drowsiness. So excessive daytime sleepiness could be also a side effect of the medication that you are taking for Parkinson's. But you need to ensure that if you are if you are feeling very sleepy during the day, how you can engage yourself and keep yourself active throughout the day. Having a routine, like if afternoon is a time that you feel very sleepy, then how you can do either like a mental game like a sudoku or a crossword, or you can just read something, you can listen to music, but do something which is little more engaging, and not just watching TV. But you can sleep for half an hour or 1 hour so. But if you set that timing, if your body clocks needs to get adjusted to it, because if you sleep a lot during the day, again it is going to affect your sleep in the night. Again you are not going to get sleep in the night, and again this is a vicious cycle which will go on and on. So I think it is important to break that cycle and follow the sleep, setting up a wake up time and sleep time and maintaining it every single day will definitely help you manage your sleep cycle. एंड सम
Okay.
रिलैक्सेशन टेक्निक्स कैन डेफिनेटली हेल्प यू. अगर आपको रात को नींद नहीं आती है तो आप थोड़ा रिलैक्सेशन टेक्निक कर सकते हैं, डीप ब्रीदिंग कर सकते हैं, प्रोग्रेसिव मसल रिलैक्सेशन कर सकते हैं, क्योंकि रात में बहुत बार बहुत सारे ख्यालों की वजह से हमें नींद नहीं आती है. तो इसके लिए आप थोड़ा सा रिलैक्स करके, अगर बॉडी और माइंड दोनों को रिलैक्स करके अगर आप लेटने के जाते हैं तो आपको शायद थोड़ा सा फर्क महसूस होगा.
Okay. Um, I think there's a question on what is the link for group physio exercises for Parkinson's, which I presume you'll talk about in the wrap-up, Nicole.
Yes.
What does one do with crouching issues, especially shoulder curling forwards every time while sitting, reading, and bending forward when standing?
So I think that is very common, not only for people with neurological conditions, but it's, I think, for everyone now, because we use the computer and the laptop so much that the
Right.
shoulders go forward. So one, what we need to do is a stretch like this, which will stretch the muscles of the front. And all stretches you need to maintain at least for 30 seconds. And that's when you get an effective stretch. Just holding it for 10 counts is not as effective. So one is opening and stretching, and in this position, deep breathing also would actually help to expand the chest. And the other thing that you need to do is strengthen your upper back muscles. So they call your rhomboids, which are between your shoulder blades, the center of your upper back. And those exercises can be done just doing these type of exercises where you're squeezing your back muscles. So those are two exercises actually which are effective for the crouching. But it's also important that during the day to activate and constantly stick your chest up as opposed to sitting this way. Always remember that if your chest is up and your sternum is up, then you're sitting straight. The minute it goes in and down, then you're slouching. So you have to constantly remind yourself, because even if you do exercise for half an hour, 1 hour in the day, but for the remaining 12 hours you're sitting like this, it's not going to help. You need to change the way you sit at all times. Whenever you remember, sit up straight, and that should be actually very helpful.
Okay, so one person's asking, my sister has a curling of toes, which is very painful. Is there anything she can do?
So curling toes actually usually would be something that we call a dystonia, which is an involuntary curling, and it's very difficult to open it. So there are different options depending on how bad it is. Doctors do give something called like a Botox injection, which helps to relax the muscle. The other option is to try and stretch it. Or there are orthotic devices which you can use to try and keep the toes extended and straight.
Okay, thank you. What is a good exercise for shoulder jam?
Sorry, for shoulder. I'm not really aware of that term.
You're not aware of shoulder jam. Okay, somebody's asked. I don't know if it meant shoulder jam. Could it be shoulder jam?
Shoulder jam. Okay, shoulder jam. Okay, shoulder jam, or sometimes they call it frozen shoulder or periarthritis of the shoulder. So usually in these kind of cases, and it's actually very common in Parkinson's, and a lot of people think it's a shoulder problem, but it's actually Parkinson's, and it's the slowness of movement which has aggravated the shoulder. And there are, in the normal progression of frozen shoulder, there are stages where it's very painful, and then it becomes very stiff, and then suddenly, and that's how the normal progression, suddenly you see that it improves. And for different stages, so if it is very painful, there are certain exercises and certain modalities that we use to reduce the pain. Right now, since you probably can't go to a clinic, just using a cold pack or a hot pack would be effective just to reduce the pain. Or if it is very severe, you could possibly take a painkiller. But you also need to do a few mobility exercises which will help. There's something called the wall climbing exercise, or just rotation of the hand. So there are very different movements depending on which stage you're in, and what your pain is like, and what is the weakness. But it's important that you do exercise to prevent it from worsening.
Okay, thanks. One question is, conch bead helpful for increasing dopamine? Have you heard of conch bead? It's, I guess, some home remedy option.
No, that's the first time I've heard it. I don't know. Tejali?
No. I don't. I'm not aware of it.
And one thing, you have to be a little careful about what people sometimes recommend. Unless it is, you do need to cross-check it with your doctor before you do take anything, because sometimes it can have an adverse reaction on you. And You know, we have people taking very different things which sometimes aren't really good for their health. And so before you do take anything, even if someone says it's just a herbal supplement, I would suggest that you do talk to your doctor, because there are certain Ayurvedic medications, you know, which do have the levodopa, and you shouldn't be taking it along with your allopathic medications, because then it's becoming an overdose for you. So anything that you're taking, like, you know, you should actually get it cross-checked by your doctor.
Okay, I think we will be winding up soon. So I think I'm just taking the last couple of questions because we also have to leave time for Tejali to do a little exercise. Any suggestion for a sad-looking face?
I think facial stiffness is also something which is very common in Parkinson's, which is also called as masked face. And
Right.
because of the masked face, you could also experience some differences or some problems with your communication, because sometimes you are happy inside, but you can't show it on your face, and that's why people perceive that you are not happy, and that's why maybe a sad face. But I think doing some facial exercises regularly will definitely help you increase the flexibility of your facial muscles, and you can express in a much better way. Maybe Nicole can help you with some facial exercises.
Yeah, we do have a lot of different facial exercises which are quite fun as well. And you know, like if you do have Parkinson's, you can definitely join our groups, and we will show you what needs to be done and how it should be done.
I guess this is more I'm not sure if it's a comment or a question. Using our voice to express our feelings and strengthen the core with the vibrations we create. What are your views about that being helpful activity for neurological patients, or is it a challenge?
I mean, so if I could just start off, like for anything, you need to strengthen your core. So if you want your voice to be better and your breathing to be better, you need to have a strong core. And when we talk about core, it means your stomach muscles, it means your back. But basically, you need strong abdominals and strong stomach muscles for your voice to come out better. So I like even probably some of the reverse things. So if you're doing your speech therapy exercises where you need to take a big breath and you need to hold it for long, that could help with the core. But it's more important that you strengthen your core, and that would improve your voice as well.
Good. Okay. So thank you, everyone. I think we will get ready to wrap up. Tejali, do you want to, will it take long for you to run through your exercise?
No, just a few minutes. We'll do it little quick.
Right.
I'm just attaching my speaker so that the music will be audible to everyone.
The Bluetooth device is connected successfully.
Okay, so we will be practicing a small progressive muscle relaxation technique. And in progressive muscle relaxation technique, what we usually do is we first contract the muscle and feel the tension in the muscle, and then slowly we release it. So for example, just make a tight fist and experience the tension and the maybe a stiffness in your fingers and the palm, and then when you breathe out, slowly release it completely. And why we do this contraction and relaxation, because if we start from a neutral line, then sometimes it is difficult to relax, but when we go to an extreme and contract, it is easier for us to relax completely and also experience the change. So I'm going to take you through this relaxation technique where you need to focus on each of the body parts as I'm going to tell you, and first contract it as you breathe in, and then release it completely as you breathe out. So just follow the instructions, and if you can keep your eyes closed during this particular relaxation technique, it will be much more effective. So let's begin. Sit in a most comfortable position, feet on your ground and palms on your thighs. Take a deep breath in and slowly breathe out. Breathe in and breathe out. Breathe in and breathe out. Now, as you breathe in, focus your attention to your toes and curl your toes in. Feel the tension in your toes. As you breathe out, release the tension in your toes and keep them flat on the ground. Now bring your attention to your ankles and lift your ankles off the ground a little. Lift your heels up and feel the tension in your ankle. As you breathe out, slowly release this tension and keep your heels flat on the ground, relaxing your ankle. As you breathe in, focus your attention on your calf muscles, and you can take your toes up to feel the tension in your calf muscles and your shin. As you breathe out, release this tension in your calf muscles and shin and bring them back to the normal position, keeping them completely relaxed. Bring your attention to your knees and your thighs, and as you breathe in, contract the muscles of your thighs and muscles around your knees and feel the tension. Tighten them. As you breathe out, release this tension and relax your muscles completely. Focus your attention on your hips and your abdomen. As you breathe in, contract your muscles of your hips and your abdomen. Tighten them and feel the tension. As you breathe out, slowly release the tension in your hips and abdomen and relax them completely. Feel that your lower body is completely relaxed. Bring your attention to your stomach and pull your belly button in. Feel the tension around your stomach muscles, your core muscles. As you breathe out, release the tension in your core muscles and relax them completely. Bring your attention to your chest and your rib cage. As you breathe in, contract all the muscles around your rib cage and feel the tension. Feel the heaviness in your chest. As you breathe out, release all the tension in your chest, bringing them back to the normal position and expand your chest. Focus your attention on your back and your shoulders. Shrug your shoulders. Take them up and feel the tension in your shoulders, neck, and your back. Push them back and squeeze your shoulder blades. And feel the tension in your back. As you breathe out, release all the tension in your back and your shoulders. Bring them back to the normal position. Take your shoulders down, your shoulder blades in normal position, and relax each and every muscle of your back, starting from the upper back, the top of the spine, bringing down to lower back. Now let's focus on our hands, our arms. Make a tight fist and bend your elbows. And feel the tension in your arms, your wrist, your palms, your forearms. As you breathe out, extend your elbows and slowly release the tension you're holding in your arms. Open your fist and let all the tension and the pain go away from your fingertips. Place your palms on your thighs in the most comfortable position and keep them relaxed completely. Focus your attention on your facial muscles and squeeze your muscles. Close your eyes tightly, close your lips tightly, and feel the tension in your facial muscles. As you breathe out, release this tension and bring them back to the completely relaxed position. Don't open your eyes yet. Just close them, not very tightly, but very gently. If you feel there is any pain or ache or stress that you are holding in any of the body part, allow yourself to relax that body part completely as you breathe out. And bring your attention back to your breathing. Take a deep breath in and observe the movement of your stomach and your chest. And breathe out. One more time. Take a deep breath in and slowly breathe out. Breathe out as if you're blowing a candle. Breathe out from your mouth. Breathe in from your nose and breathe out from your mouth. One more time, keeping your body completely relaxed. Take a deep breath in from your nose and breathe out slowly from your mouth. Breathe in all the positivity, the love, the support, the care, the strength. And breathe out all the fear, the tension, the aches and pains, the hate, the insecurity, and all the negative things going around and within you. One more time, take a deep breath in and breathe in all the positivity around you. As you breathe out, spread it to everyone around you. Let this world be full of positive souls, the loving souls, and just the message that even when we are practicing social distancing, we are still together in this. Spread this message to everyone around you. We are distanced but not disconnected. And when you feel completely relaxed and you are ready, keeping your eyes closed, you can slowly rub your palms against each other and gently place them on your eyes. And very slowly, you can open your eyes.
Thank you. Thank you, Tejali. I think that was very relaxing. I'm
Thank you.
sure some people have fallen asleep. Um, I think just a couple of questions. Nicole, there's one question. My lower back is aching excessively. I think we talked already that you can march at home. So, yes, you can. And exercise for handwriting improvement. Nicole, you'll have to unmute yourself.
So coming to back pain, actually there are many causes of back pain. One could just be something simple as improper position while you're sleeping or sitting, and especially since now we're sitting for prolonged periods of time. That could be one of the issues if it's something new. If you haven't had a fall, or if you haven't done a sudden movement and got a catch suddenly, if that is one of the issues, then it could be a catch in the back for which you need to see a therapist about it. So those are, but there are certain things if you do have back pain to avoid bending for now, avoid movements which increase the back pain, but talk to a therapist who can help you to understand what exactly is the cause of back pain.
Okay.
For handwriting, yeah, there was one question on handwriting, right?
Right.
So micrographia is one of the symptoms of Parkinson's, where your writing becomes very slow and it becomes illegible. You can't read your writing properly, and it also becomes a problem when you're signing for the banking documents. So writing practice every day is very important, and you can start with getting a book, a ruled book, something like this. So or a book that we used to use in our schools, like pink and blue book. So you start with having a ruled book and write every single day at least one page, and start with writing in capital letters, and then slowly you can progress to small letters, because capital letters you can also maintain big letters at the same time. And also practice your signature every single day, so that when you have to really sign for your banking documents, it doesn't become a problem at that time. So writing practice is very essential for everyone with Parkinson's.
Okay. All right. I think we have overrun quite a bit, and I really thank you for your time. Just kind of doing the wrap up. I think we've covered a lot of ground. So do you want to? We've, I think, covered this. Do you want to just go into contacts and how they can reach you?
Yes.
Okay.
So at the Parkinson Society, we've all had to go online now with all the services that we do. And so we are doing a lot of exercises with handouts and videos which you can access. We're also doing counseling for those who need it, and all these services are free of cost. All you need to do is, contact us via phone or email or Twitter or any of the following social media links that we have, and we can help people with Parkinson's, with any difficulties that they may have in this period of time.
And are you planning to run any group exercises, online, Nicole, over the next few weeks?
So we are looking to see how we can get a whole group. We are doing it in small batches, like 3 or 4 people at the moment, to just teach people first how to use the different apps that we have. But we are looking at doing probably group exercise programs. For now, what we're doing is putting up exercise videos so you can exercise along with the video at home. But yeah, do contact us, because we actually have a lot planned for the coming. April is Parkinson's Awareness Month, and so we have a lot of activities planned for that. But our aim is to reach out to people with Parkinson's and their families, and now telehealth is the way to go. So we're definitely going to try lots of different strategies and a lot of different things to get the therapy out to people who need it.
Yeah, also I've posted this contact number on the chat window, because I think the contact number which is displayed here is not the right contact number for Parkinson Society. So I think there's some error. I have posted on the chat window the right contact number. So please use that contact number if you are if you want to contact us. Also, you can follow all these Instagram, Twitter, Facebook handles, so that you'll get more updates on what are plans for the online sessions. So stay tuned
Okay.
for all the online sessions. Yeah.
Right. Okay. Thank you, everyone. And, this was a schedule as of yesterday. So today we talked about neurological conditions. Tomorrow we are talking about kidney disease. And after that, Thursday, Friday, we're talking about how to maintain your posture and prevent back pain and neck pain while working from home. And we're also trying to get diabetes on one of the days. So yeah, and our pages are always active. You can reach us on Facebook, Twitter, on our website, and we will, if whatever schedules come up with PDMDS, we are happy to share as well. Just quick reminders: if you're going anywhere, confirm your appointments before you go. Get e-passes. So that you don't get stuck along the way. Carry prescriptions, yours, or if you are a caregiver, then the patients. And some places are giving caregiver passes to persons with disability and for elderly, so check those out. And I think, yeah, stay calm, stay at home, ask for help if you're feeling anxious and stressed. There are a lot of resources available everywhere. And we're all working to ensure that people get access to all the right options out there. And yes, be creative, exercise at home. So I think, thank you, everyone. And I'll stop sharing. And thank you. I'll stop the live stream as well. Thank you. And I think the attendees also for taking the time and being patient with the initial challenges we had on the tech stuff. And I'll stop the recording as well now.